We're back. John is back, and we are still at the Utah Safety Council grand opening and open house, and there's lunch going on downstairs. And I came up with Cameron Ruppe for a little peace and quiet. We're going to have a little conversation. And, Cameron, he and I first met Cameron. He was the director of Utah OSHA, and Cameron led that organization for a long time, but I've been trying to get him in the hot seat for a minute, and he showed up today, and happy to have him here. And we tricked him and got him up the elevator to the podcast with the Utah Safety Council. So, Cameron, how's it going? What have you been up to since leaving Utah OSHA?
And it's Ruppe. I just want to get that out there. And I just corrected John right before the podcast.
I'm nervous.
So I just want to throw that.
I'm nervous.
But no, yeah. So I've started working for a company called Suncore, and it's one of the Clyde companies. So if you ever see Clyde companies out there, it's big company in Utah. Several organizations there. Suncore's the biggest currently, and we hope to stay the biggest of the Clyde companies. We just cleared 2,200 employees, and we're just growing and do a lot of horizontal construction, and we mine a lot of our own materials, so gravel, sand, everything like that. And so, yeah, just a really busy time and keeping people safe as a full-time gig. And we keep expanding not only our company size but our safety team size to keep up with that. So it's pretty exciting. We're doing a lot of cool things.
So how many employees over there at Suncore? You say you're expanding, but you're really expanding.
Yeah, just in February we added 270 employees about, and so that brought us just over 2,200 employees right now in Idaho, Utah, Colorado, Wyoming, Nevada, Arizona. Seems like I'm missing one state, Utah, obviously. So yeah, we're just growing, and mainly Utah and Idaho is where the bulk of our operations are.
So keeping people safe at Suncore, what's been the biggest challenge or things that you're working to do actively to, not only keep employees safe and other people on the road and, the operations that affect the public, but yeah, what's happening over there and, what are some of the challenges?
Some of the biggest challenges, I think, is no matter the job we do, no matter the work we're doing, we have exposure to a lot of hazards, and making sure that each one of our employees understands their responsibilities, and each one of our supervisors, foremen, area managers, everyone throughout the organization knows their responsibilities and is able to execute on their safety responsibilities is a challenge, just because we do a lot of different types of work, and there's a lot of different types of hazards we work around. But the exposure is always there. There's always some way somebody that can have an injury or workplace accident. And like you said, people on the road, we have a lot of variables that we can't control. People driving down the road, and so no matter how safe our drivers are, there's also members of the public we have to worry about as well.
And I want to say, I noticed on your LinkedIn that you just earned your Certified Safety Professional designation. So
I did. Thank you for noticing. I didn't see a thumbs up on my LinkedIn page. So I'm a little bugged by that, but no, just kidding.
Well, tell us what that is, and that's quite the journey to earn that. So
Certified Safety Professional has been one of those things kind of on my to-do list for a lot of years, but with most of my roles, I just haven't had the immediate need for it. But it's always been one of those things I wanted to attain. And so just this past year in October, I went and I took the ASP exam so that I could then prepare for the CSP exam, and then just last month I took the CSP exam and passed. And so yeah, now it's official. I'm a certified safety professional finally, after several years in the safety industry. So I'm excited for that. And it's a good credential to have. And I've encouraged my team to pursue some kind of credentialing so that they can continue working towards something. And CSP is one of the things that's on a lot of their radar as well. So we're excited for more of my team members to get that certification as well.
Well, you passed it, got it done on the first try, so congratulations.
First try, thank you.
I want to say that normally comes with a big fat pay raise. Hopefully Suncore complied with that.
No comment, but yeah, it's one of those things that just creates a lot of opportunities for you. Growth in our company is hugely based on how we progress, right? And so it's been really cool to be part of that progression and show my team members that there's ways to make yourself stand out in those situations where you're looking for an advancement or you're looking for raises, things like that. That's been the biggest thing, is helping set the standard for my team. So,
well, you have had a storied career in safety. As I mentioned before, you were the director of Utah's Occupational Health and Safety Administration. How long did you serve in that role? That's when I first met you. You were the current director, but
yeah. So in 2016, I came on to UWash as a field compliance manager, and then in March 2017, our previous director, Chris Hill, was promoted to be the Labor Commission's deputy commissioner and chief counsel there. And so once that position was vacated, I was hired by Jason Mon, the commissioner, to be the replacement for Chris, and that's an appointed position. So Jason appointed that position, and then it's kind of fun because you have to go up to the governor's office and he has to sign off on that. I didn't meet with Governor Herbert himself, but I did meet with his chief of staff, and they interviewed me to make sure I wasn't super weird or anything like that. And then that appointment was made. So I was there 2017 as the director until 2022 as the director. Yep. So
you were there through the COVID years. Are there any memories or challenges or fun experiences during your time there, especially through COVID?
Yeah, lots of fun experiences. COVID, I wouldn't say there's tons of fun experiences during COVID, but no, we had a lot of cool opportunities to pivot as a team and really understand where some of the burdens we put on ourselves existed, just as far as where do we need to be in an office, where don't we need to be in an office, where is our time more valuable being in a vehicle on the way to job sites and being at job sites. And so that was pretty cool to see that even during COVID, while a lot of our neighboring states and their OSHA programs maybe saw a dip in the number of inspections they did, Utah really never stopped doing what they did. And that was really, really helpful to show people, like, we're still doing the work, right? Even though we're not reporting to an office day in and day out, we're still out there doing the work. And we were able to show people continuously how many hazards we were able to identify in the workplace. But yeah, just so many cool experiences, so many cool industries, so many cool companies that I've gotten to work with over the years at UWash. And it was really a blessing to be part of that, and to see all the things that Utahns do, and how our industry stays alive and how our economy benefits from that.
Yeah.
So.
Well, how was your experience, your time as the UWash director working with federal OSHA? Maybe talk about that and explain, how it works with states like Utah that has its own statewide OSHA program and its relationship with the federal OSHA program.
Yeah, so that's kind of an interesting thing that not a lot of people understand fully. But the federal government has the charge basically to ensure that we have OSHA programs either in a state or at the federal level in all 50 states. But very early on with the OSHA Act, there was a clause in there that basically allowed for state plans to be created, and so state plans were created as part of that. And initially, there were very few state plans. Utah was one of the early states in there, and there right now are 29 state plans, and I believe there are 23 of those. I might be wrong on that number, but 22 or 23 of those have full jurisdiction over all private sector and public sector employees in the state. And then there's some states that only have jurisdiction over the public sector employees in the state. And so working with OSHA, there's a regional office just here in Denver, and that's Region 10, and they have responsibility for the state plan states in that area. But basically that relationship is a partnership and keeping people safe. So while Utah and Utah Occupational Safety and Health has the responsibility to enforce occupational safety and health laws in Utah, federal OSHA kind of oversees that and makes sure that we're being at least as effective in them and in the way we do that. And so, for the most part, it's been very very positive relationship. There's always some disagreements between states and the feds on certain things, and state legislatures have strong opinions about certain things, and we've had to be kind of the buffer between those at times, but at the end of the day, we're just trying to keep people safe, and that's what UWASH does, that's what OSHA does, and so that's been a pretty cool partnership, actually.
Good. It's from Cameron I learned, when I first met Cameron, and I was invited to serve on his advisory board up there at UWASH, and he would have everybody come in and he would just talk about the stats and what's happening in Utah when it comes to safety. And of course, our construction companies and our manufacturing companies do a lot to keep their workers safe. But I was surprised to learn how dangerous it can be working at hospitals. So maybe talk about that a little bit, maybe how even the public, when we visit, our loved ones at hospitals, how, the challenges with doctors and nurses and patients and family members in hospitals.
Yeah, it's kind of an interesting one because a lot of the injuries that are reported from hospitals are the things you see in other industries like falls and people hit their head on overhead lights, things like that they're using for procedures. But there's actually quite a few workplace violence type situations that happen when a patient attacks a nurse or a doctor or even family members at times attack a nurse or a doctor. And so a lot, when I say hospitals, I don't want to make it too general because there's a lot of nuances in that statistic, but there are plenty of situations where the human element, the human variable that we can't always prepare for is the hazard, right? And just like on the road, you can't always prepare for what somebody will do behind the wheel of a car. You can't always prepare for what somebody will do when they wake up in a hospital bed or they get poked and prodded for the umpteenth time and they're upset with the doctor or something like that. And so there's a lot of those things that go unreported, and there's a lot of those things that, again, do go reported, but it's hard to get a real solution in place, at least from a regulation standpoint, to address that hazard. Now, most of the hospitals and medical facilities in Utah, I think, do a really good job at controlling for that. But from a regulation standpoint, that's a hard one to really say this will fix the problem, right? So, lots of those, and always one that left us scratching our head. What can we really do to affect this?
Well, when you left, we missed you. You left it in good hands, and Floyd, he's been great. Floyd Johnson, who's been on the podcast, and he serves on our board, and so bringing him up was very much appreciated. I think the state of Utah will all agree that the work you do and are still doing is very much appreciated. And so, what we don't know about Cameron Ruppe is that he's a big Scally Cap fan, right?
I am a Scally Cap fan. Yeah. My kids think it's super nerdy, and so I'm going to keep wearing them. But yeah, I wear a Scally Cap most of the time. When I'm wearing a hat, it's almost always a Scally Cap. Yep.
Very cool.
Hashtag Scally Cap. I don't know if they're still around. I still have it, but
yeah. I'm a fan.
Yeah, good deal.
Well, very good. Any last words of wisdom for anybody out there?
I mean, me and Floyd were actually just talking about this outside. Me and Floyd and Evelyn partner, but and Floyd's a great guy. He was actually one of my first hires that I was able to make at UWASH, and I'm so grateful that we got him when we did, and then that now he's in that chair because he does a great job. But one thing we were talking about outside is we tend to focus on a lot of stuff as safety professionals. We have a lot of stuff going on, and it's easy to just get lost in that minutia. And I kind of wish the safety world in general would focus a little bit more. And if you really look at the ways people get hurt in your companies or wherever you are, if you focus really significantly on those few things, those handful of things, you can really make a difference in those areas. And then I have a friend who says, if you focus on the corners, the middle will take care of itself, right? If you focus on those corners, the rest of that stuff's going to come along with it, right? And so as you look at your hazards, we always talk about falls, cut in between, struck by, and different hazards like that. But man, if you look at injury data for the last 60 years, that's what's hurting people. That's what's killing people. And so if you can find out where that exposure is in your companies, and just address that and focus on that, again, the middle is going to take care of itself. And so I just encourage folks to give yourself a little bit of a breather so that you can really focus on where our main issues are, and then focus on those things. And you're going to see some huge improvements from that kind of stuff.
Very good. You mentioned Evelyn Partner, and you want to explain who Evelyn is. And you might think, if you're listening, that OSHA's all about writing citations and compliance, but I believe Evelyn's a part of the whole consultation part of UWASH as well. Yeah.
So there's two things there. One is UWASH does have a consultation program. Every state has a consultation program, and Utah's is very very good at what they do. They've been doing it for a long time. And Evelyn served in both a compliance role and a consultation role over the years. And right now her role is actually compliance assistant specialist, and she does a lot of work with companies who are working on voluntary protection program, VPP, and then the SHARP program in the state of Utah. And so just a lot of cool things that if you're looking for an opportunity to just up your game in safety, Evelyn's a good call, and she is really, really, really good at her job. Me and Floyd were talking outside again about how I get a lot of questions about my time at UWASH, and there's a lot of names that pop up in those conversations, but nobody pops up more often than Evelyn Partner. She does a great job, and she's made a really good impact across the industry in the state.
Well, very good. Well, Sunrock is very lucky and fortunate to have you. And again, congratulations on all your success and continued success. And excited to see what you do in the future.
Thanks, and congrats on the new building. It's awesome. It's great to see you.
Very good. Thanks.